It's a good segue for Dr. Brethauer from the Cleveland Clinic to talk about, more specifically about fellowship training in preparation for bariatric surgery.
So I'm here representing the ASMBS, which is American Society for Metabolic and Bariatric Surgery. Specifically for the ASMBS, in terms of what it means to do a bariatric fellowship. So probably over the last decade, bariatric surgery has really become its own niche, its own subspecialty within general surgery. Most programs that have residents or have some exposure to bariatrics, a few don't, but many and most do actually get some exposure to bariatric patients. It's just quite variable in terms of what the residents are able to do during their residency in terms of caseload. But ultimately, I think if you want to have bariatric surgery as part of your practice, you really need to devote some time to it. And I would just reiterate what's been said already, which is this 1 year of fellowship may be one of the most important years in your surgical training, because it really sends your career on a trajectory in a certain direction. And you can tailor that as time goes on, but you really are choosing to go down a certain path professionally. And the way when I tell my people in my program and people that are interviewing, I think, you really ought to look at fellowship as a catalyst for your career. Whether you want to go and be a private practice surgeon and have a high volume private practice, or you want to be in academics, you can find a program to train you adequately for that. But it's you want it to really throw some gas on your career and really propel you in a certain direction. Who you train with and where you train certainly play a big part in that. So when you look at different programs, think about, do you want more of an apprenticeship experience, or do you want more of a high-end academic experience? Because that's going to put you in different directions after your fellowship's over. And part of bariatric surgery is not just the operations, it's the management of the disease of obesity and managing the obese patient preoperatively, postoperatively, understanding the disease of obesity. And what I really like about bariatric surgery is that you get involved in a lot of these other medical comorbidities, and you really can become an expert on diabetes and sleep apnea and medical management of some of these other things that we see get better after surgery. And when you finish, you have a very marketable niche. And I can tell you that most people who finish bariatric surgery fellowships don't go out and do just bariatric surgery. And that's one of those things, almost every interview I have, the applicants are saying, I really want to do bariatrics, but I don't want to do just bariatrics. And I think we all get that. And I'm about 30% general surgery. We're always about half and half. And I think most of us that have or consider ourselves bariatric surgeons also do a lot of general surgery and foregut surgery. So you're not boxing yourself in by doing a fellowship that sort of is billed as bariatric only. I think those skill sets translate well to a lot of other operations. We talked about that. Part of what you learn, though, technically, and I think specifically the gastric bypass offers, 2 intracorporeal anastomoses, very difficult laparoscopic exposures, and those are skill sets that translate well to pretty much any GI, at least abdominal surgery. May or may not translate to some challenging solid organ stuff, but it's a skill set that you acquire by repetitively doing this over and over throughout the year. You can really get quite facile at these techniques. We pretty much live in the left upper quadrant and at the hiatus, so foregut surgery is not something that's going to be foreign to you. When you finish, you're going to be able to tackle the big paraesophageal hernias, the spleens, the distal pancreas, and those kinds of things, because that's territory that we live in every day, doing sleeves and gastric bypass surgeries. So the application for bariatric fellowships is through the Fellowship Council, as was mentioned. And that's just this last year and 2 years, I guess, for the application cycles has switched from the 5th year to the 4th year. So you'll be applying in the and interviewing you apply in the fall of your 4th year, so the beginning of your 4th year. So last fall they applied and the interview cycle just ended. So it's kind of early spring of your 4th year that you're doing your interviews, and then we'll match. And then so the interviews we just completed are folks that are going to be starting 2016. So there's a gap there, but it allows you to tailor your 5th year a little bit in terms of electives and getting some exposure to things that you're interested in and that you're going to continue on with in your fellowship. We did move the fellowship year, academic year, from August 1st to July 31st. That's going to start with this incoming group in July, and that's to allow graduating residents time to finish, get their boards taken, and start without this frantic transition from residency to fellowship. So what we look for in our applicants anyway, and I think most people have already said these things, but demonstrate a clear interest in that field. I'm not offended when somebody says they don't want to just do bariatrics. I think that's fine. I don't want to just do bariatrics either. It just is my academic focus in my career, but we all like to do other things. But it is important, I think, to have some experience doing some advanced laparoscopic procedures during your residency. And so those case logs that you put onto your fellowship council application, and when we talk in your interviews about what are you doing now, what are you actually doing in the OR, we like to hear that at least you're doing some advanced cases laparoscopically, so that you come in with some advanced skills in terms of suturing. Try to connect with the bariatric surgeons at your institution. Even if you don't do rotations, get connected with them and try to do electives and get exposure. And if you can, try to do research projects and write papers with your bariatric and foregut surgeons. Scholarly activity and publication certainly shows an interest and also demonstrates that you're a finisher. You can do things from start to finish, get it done, get it published, and that says a lot about your interest and abilities. And then, again, letters from people we know, you've heard this before, is really important. Phone calls are obviously very important as well. The current requirements for numbers for ASMBS certification. Now, the Fellowship Council accreditation requirements are what I'm listing here, but they're also the ASMBS also offers a bariatric training certificate based on these case numbers, plus a well-defined curriculum that most programs adhere to. But you need to do 100 bariatric cases. 51 of those need to be as primary surgeon, meaning you did over half of the case. And this is becoming a bit more of a challenge now, is 50 of those have to be anastomotic cases. And you may know the sleeve gastrectomy has overtaken the gastric bypass in terms of the most commonly performed procedure in the United States and actually worldwide. And so when you look at programs, make sure you understand what their case mix is, what their trend is over the last couple of years, and what they expect in terms of their case mix, because you don't want to finish your bariatric fellowship only knowing how to do a sleeve gastrectomy and not being comfortable doing an anastomotic procedure. That's not what people are looking for when they ask you to start their program or build a program or come in as a partner. 10 non-anastomotic cases is clearly not a problem these days. Revisional surgeries are becoming much more common, so again, when you're looking at programs, find programs that are doing fairly high volume of revisional cases. That can be, bands to bypasses, it can be VBGs to bypasses, and revisions of gastric bypasses. There are a lot of things that fall under revisions, but that's an important skill set that you can get during your fellowship that will serve you well as you go out and practice. And again, since 99% of cases are done laparoscopically, now this is not really an issue getting the laparoscopic experience. And then part of the certification is also getting the continuum of care with the patients. There's a log that's submitted to demonstrate you've seen these patients preoperatively in the hospital and postoperatively, and that continuity of care is really important in the management of the obese patients. I talked about the curriculum. I won't show it here, but it really covers all the major topics surrounding bariatric surgery, including sort of program management, how to start a program, build a program. And so when you finish your bariatric fellowship, there's still volume generally is pretty flat in the United States. It's somewhere between 170 and 180,000 cases a year, and that's been pretty steady over the last 2 or 3 years. And a lot of that has to do with access issues, and the market may just be at a steady state right now, but there's still many opportunities out there to do bariatric surgery. You have to go to a place where it's committed by the hospital and the enterprise that they're going to invest in a program and make it successful, because there's lots of moving parts to a successful bariatric program. But if done well, it can be a great service line and a good revenue stream for the hospital. So it makes you marketable if you have this skill set, whether you're starting a program or stepping in to help build up the volume of the program. And again, of the 28 fellows I've trained, over half of them have just gone into private practice, have done quite well, become foregut surgeons, and then over time built their bariatric practice. Like Rohan was saying, you start out doing what you what comes your way, taking call and doing foregut and general surgery, and your practice will morph into a bariatric specific practice if that's what you want. You'll have the skills to do that. The other thing I'll just say is bariatric surgery. I was actually very interested in surgical oncology when I was a resident. That didn't work out because I was in the military and I was gone all the time, and I ended up going to the MIS bariatric route. What I can say is I got a late start in my academic career. I was in my late 30s when I did my fellowship, and it's a specialty that's ripe for young, energetic people who really want to make an impact in their specialty early in their career. We're always looking for people who are willing to step on committees, do the work, and there's a fairly rapid progression of your academic and your national reputation if you really put the time in, and it's a specialty that really offers that kind of opportunity if you're interested in stepping on a bigger stage in your career, fairly early in your career. All right, and in terms of research, there's lots of questions. We do these operations, they work well, and we're still trying to figure out why they work so well in terms of diabetes and glucose metabolism. So there's lots of research questions that remain to be answered. So if you're interested in academics, bariatric surgery and translational research is really a ripe field for research opportunities. Thanks a lot.